Hello, my name is John Brisson, author of Fix Your Gut and Health Coach. Welcome to the Fix Your Gut YouTube channel. Today we're going to discuss the condition known as burning mouth syndrome. What are the symptoms of it? What might be the causes of burning mouth syndrome? And what you can possibly do to relieve your burning mouth syndrome. Now, there are a multitude of different symptoms of burning mouth syndrome, and the majority of symptoms differ from person to person and are strongly subjective. So much so that it's almost common as silent reflux. You know, people actually have reflux into their larynx, into their mouth, and they have symptoms of postnasal drip or mouth issue, like poor oral like health type issues, or chronic cough, or chronic throat clearing, things that you don't usually associate itself with reflux. And burning mouth syndrome is very similar to that. So the degree of severity of the symptoms also varies in magnitude and within frequency too. And symptoms of the condition may be relieved when eating or drinking, similar to silent reflux. Has a higher chance of occurring in the elderly, and also has a way higher magnitude, greater chance of occurring in females than males, anywhere from 3 to 1 to 16 to 1. Also, people of Asian and Native American ancestry have a greater chance to develop the condition, and people of African heritage are the least likely to develop burning mouth syndrome. Usually, burning mouth syndrome usually lasts for about 2 to 3 years before it kind of resolves itself or goes in remission. Just got the claim out of the blue, if it does. But there have been some cases of lasting even to 10 to 12 years, which is an extremely long period of time of having a condition. So some of the symptoms of burning mouth syndrome are anxiety, altered blink response when your eyes are stimulated, decreased appetite, decreased salivary flow, depression, digestive issues, dizziness, altered taste in your mouth, or a food that you ingest. It may be bitter or metallic, fissured tongue, a geographic tongue, a globulus pharyngeus, which is like a lump in your throat type feeling, increased thirst, numbness or weird feeling of the oral cavity, reflux sensation in the esophagus, throat, and oral cavity burning sensation, tongue burning sensation and pain, oral cavity mucosal pain, sleep disturbances, TMJ, tongue swelling and redness, and dry mouth. There are 3 subtypes of burning mouth syndrome, which are known as the Lamley and Lewis burning mouth syndrome classification system. And those include subtype 1, which is shown in about 35% of the time. Characteristics include symptom-free waking, progressive burning sensation developing in the late morning, and gradually increasing in intensity, reaching its peak by evening. The same can actually be said about silent reflux for a lot of people, where that follows the same type of pathology, where people with silent reflux, when they first wake up in the morning, tend not to have very many symptoms. Not everybody with silent reflux, but some people. And it tends to gradually go throughout the day. And also, unlike GERD, where most people with GERD have heartburn when they sleep, people with silent reflux generally do not have any symptoms when they sleep. Not always, but generally they don't. Subtype 2 is about 55%. Characteristics include continuous symptoms throughout the day, present upon waking, difficulty in sleep, and frequent sleep disturbance due to the symptoms. Subtype 3 is about 10%. Characteristics include intermittent symptoms present only on some days, affecting sites that are atypical within the oral cavity. Now, generally, with the pain that one gets during burning mouth syndrome, one thing I want to mention is located bilaterally and symmetrically in the anterior 2/3 of the tongue, followed by the dorsum and lateral borders of the tongue, the interior aspect of the hard palate, and the labiomucosal of the lips, and occurring in multiple sites. Its less commonly reported sites include the buccal mucosa, which are the cheeks, the floor of the mouth, the hard and soft palates, the top, and the throat. And the sites of pain do not seem to affect the course of disorder in response to treatments. As well as the symptoms are usually spontaneous for most people, with no immediate identified factor why they develop in most cases. That being said, there have been some people similar to silent reflux who mentioned they have an upper respiratory infection, or had some sort of previous dental procedure, or took and medications including antibiotics right before the burning mouth syndrome or silent reflux had occurred. So they may be a link, and we'll get to why that is, about maybe the causes of burning mouth syndrome. Diagnosis of burning mouth syndrome is easily made by an oral examination by a dentist, oral surgeon, or primary care physician, and by medical history and symptomology. Blood tests may be performed, including complete blood count, fasting glucose, inflammation like hsCRP, nutritional deficiencies, and thyroid. Oral microbial cultures and examination to determine if there's any type of infection. Viral antibody testing, oral biopsy, allergy tests, salivary measurements, and tests to determine if reflux is occurring. Medical imaging, including MRI and CT scan, and review of medications and supplements, because some medications are known to cause burning mouth syndrome. So diagnosis of this condition may be difficult because the symptoms match other conditions and vary. And usually it takes, for one who actually gets burning mouth syndrome and actually get the diagnosis of burning mouth syndrome, for the average person it takes about 34 months, which is a very, very long time. That's almost 3 years. So what are the many causes of burning mouth syndrome? Allergic reactions. I have those listed on my blog. Mercury-containing and bisphenol A, which bisphenol A fillings and mercury-containing amalgams could both be. Dental procedure complications due to nerve injury. Dentures, having a geographic tongue. Hyposalivation, which could be medication-induced. Anticholinergic medications like Benadryl will give you dry mouth. Antidepressants, antipsychotics, anti-anxiety type medications. Radiation therapy can damage the saliva glands. Salivary gland disorders, as well as salivary stones, which block the production of saliva. Oral infections, bacterial, fungal, parasitical, and viral. The microorganisms that are implicated with burning mouth are Candida, Enterobacter, Klebsiella, Fusobacterium, Staphylococcus aureus, which is staph, Citrobacter, and H. pylori. Bruxism, clenching, the way you position your tongue. Permanent oral cavity metal fixtures, like a stainless steel retainer. I used to have one in the bottom of my mouth. Root canals, if there's any infection within the root canal. TMJ, temporomandibular joint disorder, as both a cause and a symptom of burning mouth syndrome. And you can also have systemic things too that have also been associated with it that are outside of the oral cavity, including abnormal interaction between the sensory functions of the facial and the trigeminal nerves. Anxiety, blood flow disturbances within the oral cavity, connective tissue disease, deficiencies in iron, zinc, copper, magnesium, calcium, vitamin B1, vitamin B2, vitamin B6, folate, vitamin B12, and vitamin D have all been implicated as a cause of burning mouth syndrome. Diabetes, which can trigger neuropathy, heavy metal toxicity, cadmium, mercury, nickel, and palladium have all been implicated in burning mouth. Histamine intolerance and mast cell activation disorder. Many people with burning mouth syndrome suffer from histamine intolerance and increased histamine. Stress and adrenal fatigue, hormonal imbalances, increased activity of the nigrostriatal dopaminergic system, altering the sensation of pain processing. Lichen planus, menopause. Medications, ACE inhibitors, have been indicated as a major cause of burning mouth syndrome, and they also deplete zinc, and zinc deficiency has been linked to burning mouth syndrome as well. Antiretrovirals or protease inhibitors, hormonal replacement therapies, both having hormonal imbalances, and the replacement therapies like Premarin have been associated with burning mouth syndrome. L-thyroxine, which is synthetic thyroid hormone, and the medication topiramate. Multiple myeloma, niacin toxicity, neuropathy, whether it's diabetic, small fiber neuropathy, or large fiber neuropathy, poor thyroid health, reflux diseases, mainly silent reflux, Zika syndrome, Sjogren's syndrome, stress, systemic lupus, upper gut dysbiosis of the oral cavity, the esophagus, and the stomach, viral infection, acute viral infection, and viral reactivation, herpes simplex 1 and 2, varicella, Epstein-Barr, and cytomegalovirus. All of those are the multitude of known causes for burning mouth syndrome. And that's why I definitely recommend, if you are suffering from burning mouth syndrome, that you work with either a really knowledgeable integrative doctor or a really knowledgeable holistic dentist, so they can help determine the exact cause of your issues. Or contact me. I offer coaching. I've coached many people with burning mouth syndrome. And it's a difficult disease to try to figure out exactly what the cause of the issue is. So how might one find relief? Now, I have more in detail of this on my blog, which I'll link to at the bottom, but I do want to briefly go over this. Run a SpectraCell test to rule out iron, zinc, copper, magnesium, calcium, vitamin B1, B2, B6, folate, B12, and vitamin D deficiencies that I talked about earlier as being the cause. If you have any deficiencies in those nutrients, correct them. If you're dealing with silent reflux or upper gut dysbiosis, relieve them. Test for herpes simplex 1 and 2, varicella, Epstein-Barr, and cytomegalovirus antibodies. And if they show viral reactivation, relieve the viral reactivation. Because remember, the nerves, trigeminal nerve, a lot of these herpes viridae viruses, they live dormant in these nerves that are up here around your jaw, and they can trigger burning mouth syndrome type symptoms, even silent reflux, by weakening the upper esophageal sphincter. If you're obese or believe that you have diabetes, monitor your fasted blood glucose for a few weeks and see if you are. If you are diabetic, work to overcoming your type 2 diabetes. Proper exercise, diet, proper sunlight exposure, proper circadian rhythm, magnesium supplementation, all of those are important for someone suffering from diabetes. Increase mitochondrial function in the hope that they relieve their type 2 diabetes. Get a heavy metal hair test performed and determine if you have elevated amounts of cadmium, mercury, nickel, and palladium. If you test positive, detox to heavy burden. I recommend the Andrew Cutler protocol. If you're taking any of the medications that I mentioned earlier, definitely ACE inhibitors. Talk with your healthcare professional about maybe switching to a different medication if you're suffering from burning mouth syndrome, because all of those medications I listed earlier are listing cause of burning mouth syndrome. If you have root canals, metal-containing oral hardware, dentures, mercury amalgams, bisphenol A-containing fillings, consider replacing, correcting the dentures, or removing them properly by seeing a well-trained holistic dentist, and see if that helps improve your burning mouth syndrome. Practice proper oral hygiene, improve thyroid and adrenal function. Proper supplementation of iodine and selenium may help improve thyroid function. Following a good diet like the Perfect Health Diet may reduce inflammation and improve symptoms by increased ingestion of omega-3 fatty acids over omega-6. Proper sunlight exposure, circadian rhythm, and sleep hygiene may reduce inflammation. I recommend, as long as you're not mercury burdened, meaning that you've tested positive in a mercury heavy metal test, or you have mercury amalgams currently in your mouth. If that is the case, you do not take the supplement alpha lipoic acid or R lipoic acid. But if you do not, if you've never had a mercury amalgam, you don't think you're mercury toxic, then yes, supplementing with R lipoic acid has been shown in studies with people with burning mouth syndrome to help, and that might be because it's a very potent antioxidant and it does increase intercellular levels of the master antioxidant, which is glutathione. If you're suffering from histamine intolerance and mast cell activation disorder, make sure that you relieve those conditions. Look into the use of low-level laser therapy, which is cold laser, or red light LED therapy. Both of those have been shown in multiple studies to greatly help improve inflammation and reduce the symptoms of burning mouth syndrome. So I definitely recommend looking into those. And finally, run a proper hormonal test like a Dutch urine test and determine if hormonal imbalance is contributing to your burning mouth syndrome symptoms. If they are correct that imbalance. So yeah, definitely read my blog on burning mouth syndrome. There's a lot more information on that. I'll put a link down at the bottom. And as always, please like, share, and subscribe, and have a great day.